Hi, welcome to the Spine MDT. So this video is about spinal problems in golfers. Spine problems are actually the commonest problems within golf in terms of injuries caused to the body. So we'll look at some of the mechanisms that cause that, measures you can take to help prevent it and also improve your pain whilst continuing to play the sport. Spine disease affects a lot of golfers, but including the professionals. Tiger Woods is probably the most famous story of someone who was incapacitated with back pain, left the sport for quite a few years and eventually actually required surgery, but did return to the sport and was still quite successful. As you can imagine, this generated a lot of interest in the sports medicine and spine surgery community. And then eventually our colleagues at the Barrow Institute in Arizona published this important study in the Journal of Neurosurgery Spine Edition. They looked at various factors in golf, and there's software that professionals use to try and examine the biomechanics of their golf swing to achieve the most efficient and most powerful swing, generating the most speed when hitting the ball. There are two components, as you know. There's the upswing, which should be slow and measured, and over time techniques have changed, but essentially you've got a slow and measured upswing where you're storing potential elastic energy that's then converted to the kinetic energy during the downswing when hitting the ball to get maximum impact and speed. During that rotation in the upswing, you get shearing forces here in the annulus of the disc from that rotation, that twisting, causing it to tear. That in itself can cause slip discs and protrusions. And then during the downswing, you get this lateral flexion downforce between the two bones, causing bony knuckles, or what we call osteophytes, to form on one side. And that's the key factor in golfers. Spine disease tends to be predominantly unilateral. On their scans, you see the disease of the wear and tear on one side predominantly. To create that potential energy or elastic energy is related to what they call the X factor in golf. If you draw a straight line across your pelvis and another straight line across the shoulder blades, the bigger this angle in the rotation you generate, the more energy you can preserve and store. So that's a lot of rotational force on this part of the spine. So part of the protection is increasing flexibility in order for you to be able to tolerate that. Another study in the Global Spine Journal, AO Spine, published in 2022, showed that there is some asymmetry in the size and strength of some of the core muscles, i.e. the oblique muscles that go across your abdomen that help generate that rotation across your waist tends to be stronger on one side than it does on the other. And there's a suggestion that that in itself accelerates the degeneration in the spine. Therefore, a lot of the treatment or prevention is aimed at reducing that amount of asymmetry or imbalance between the strength in the muscles on either side of your body. So rotational exercises to help you become more flexible, and also carrying out, I suppose, similar maneuvers to strengthen the opposite side is really important. If other joints in your body are stiff, such as the hips and the knees, then that requires the spine to be even more flexible during that rotation and adds a lot more force to it. Something that was hypothesized in Tiger Woods' injuries. He had problems with his Achilles heels, his hips, and therefore during his swing that put more stress on his spine. So another brilliant study published in the International Journal of Sports and Physical Therapy, the Golfers 4, looked at all of these factors and came up with a program to focus your training on. So we talked about improving rotation, and this should be done both sides. So half kneeling thoracic rotation against a wall with a ball between your knee and the wall. And then you go from the neutral position, i.e. facing forward, to slowly rotating around and just increasing that amount of potential rotation that you can. And you do that on both sides. Also improving exercises here, reverse wall slides in squat, sliding your arms up and down like so to improve your shoulder flexibility is really important. That gives the spine a little bit of room to breathe during rotation. and then also building up the strength of the upper back with the modified robbery by just pulling a resistance band towards you with the knees partly bent and then rotating outwards, external rotation of the shoulders. And there are more exercises here explained, and the link is down below. But before engaging in any of this, I'd strongly recommend seeing a physiotherapist who can just tailor some of the exercises towards your ability, depending on your current pain threshold and what's causing your pain. So an assessment is really important before diving in with these exercises. Prevention is always better than the cure. So even if you don't have symptoms or you've just got very mild symptoms, start doing exercises to improve rotational stability and make sure that they're symmetrical. When you golf swing, it's usually a one-way thing. You never swing if you're right-handed, you don't do a left-handed swing. So rotation and exercises that build both halves of your body is really important to prevent injuries. It's extremely rare surgery will be required with these sorts of injuries, but some of the scenarios you see is when you've got quite severe disc generation, as shown on this MRI here, where all the other discs are healthy, but the lowest disc here is quite worn, and you can prove with a series of tests that that is the pain generator. I've done a video on this specific condition, the link is below. So this patient here, just like Tiger Woods, required that level to be fused, and you can see here on the right the CT scan. In that disc space you've got the cage with screws anchoring it in so that the two levels fuse up. There are different ways to fuse up the spine, going in through the back of the spine or going in through the front. One of the factors believed to be beneficial in the spine community, especially in the first paper I showed you, is to go in through the front, just as Tiger Woods had, because you don't disrupt any of the muscles at the back that support the spine. So that operation is called an anterior lumbar interbody fusion, or ALIF. I've done a video of it here on my YouTube channel. Please click the link and also subscribe to the channel for more videos related to the world of spine. So overall, conditioning your spine by maintaining flexibility, particularly rotation, is really important. Building up strength of your core muscles symmetrically, so both the rotational strengthening, but make sure both sides are done equally throughout your golfing and your training to help prevent things, and this is also part of the treatment. Highly recommend using a personal trainer if you can afford it, if you're practicing golf, if you're really keen on golf as well. And then if you start to experience injuries, please seek the advice of your physiotherapist. I hope you enjoyed the video and found it helpful. Please subscribe to the channel for more videos related to spine disease and management. The goal of Spine MDT is to find the least invasive solution that gives you the longest lasting result. We're able to do this by working with a team of surgeons, physiotherapists, pain specialists, osteopaths and chiropractors to meet that goal. Please contact us if you need anything. We're very happy to help you. Thank you.